Because yesterday when
Start.
okay, hello,
Hello.
this is Dr. Gabra, the doctor in the medical admission unit. Are you Mr. Adam Smith, 28-year-old?
Yes, doctor, I am.
Okay, we are here today to discuss your medical condition, and I will examine you. Is that okay with you?
Okay, doctor. I really want to know what is happening with me.
As I understand from the GB letter that you have elevated body temperature. Is that correct?
Yes, doctor.
Can you tell me more about it?
Doctor, for the last 2 days, suddenly at night, I developed chills and rigor, and I noticed that I am feeling so much cold, and my body temperature was rising, and it rapidly became so high temperature that my body temperature raised a lot, and that didn't settle down till the morning. And in the morning, I took some paracetamol tablets from the pharmacy that made me feel better. And then I to make an appointment, urgent appointment to the with the GP. And then GP examined me, and he took some my relevant history, and he ran some blood test. He also gave me some paracetamol, and with the paracetamol, I feel little bit good, but the fever isn't totally go away. Isn't totally going away. I almost all time feel the feverish, and after taking the paracetamol, after few hours, I again feel the temperature is rising. But my GP informed me today morning that my all my blood tests are normal. So he's thinking that there might be something abnormal. So he sent me here.
I'm sorry about all your suffering. I will try to help you out with this. Mr. Adam, is it the first time that you have high temperature, or it is first time?
This type of event didn't happen before.
So no past history for
No,
similar. Okay, does it started all of sudden or gradually?
all of a sudden, doctor.
And does it increase by time or decrease?
Uh, I think not so much increasing. This high from the beginning.
Mm. And did you measure it in anyhow?
Yes, doctor. My GP measured it. It was 104.
I'm sorry about that. And does it stay all the time or go and come?
It's still all the time. Just taking some paracetamol make it somewhat lower, but it doesn't go away totally.
Okay. And you said you have start from beginning.
Okay, continue.
Okay. Any sweating along with the high body temperature?
When the fever goes away, that at the time I feel sweating, doctor.
Any shivering?
Yes.
Okay. Do you notice anything make it better? You mentioned the paracetamol. Anything else?
No.
Anything make it worse?
No, doctor. It just without paracetamol, I feel very bad.
Mr. Adam, can you tell me any other symptom you have together with the temperature, like cough or anything?
Yes, doctor. I feel also very discomfort all the time for the last 2 days, and also I feel pain all over my body.
What is the pain exactly in your muscle?
Yes, doctor. All my
Any specific
muscles and
any
also
specific
more
part
pain.
of your body?
Yes, a specific part that is I feel more pain behind my eyes and also over my spine.
I'm sorry about that. I will try to help you out about it. And this pain, you can score it from 0 to 10. The 0 is the lowest, 10 is the highest.
I would say, doctor, it is 6.
I'm sorry about that. Do you take anything to make it better?
Taking paracetamol somewhat decreases the pain, but it is not going away totally.
And is it the same all the time, or it come and goes, increase and decrease?
No, doctor, same all the time.
So it's the same at the early morning and same at the night.
Yes, doctor.
Do you have any neck stiffness? Sorry,
No stiffness.
no stiffness in the neck. Any other symptom you have, like cough?
No,
No cough.
no,
No tummy pain.
no,
Do you have any change in your eye, any redness or anything?
no, doctor.
Do you have any headache?
I think pain is more behind my eyes, and that also causing some headache.
Okay, and this headache, can you specify the area of the headache? In which part of your head? Only behind
Forehead,
your eye?
behind my eyes. Yes, doctor.
And it does it stay all the time?
Yes, doctor.
I'm sorry about that. Any change in your vision?
No,
Any change in your appearance?
no,
Do you have any flu symptom, like nasal congestion or nasal
no,
secretion? Do you have any post-nasal drip?
no,
Any shortness of breath?
no,
Any tummy pain?
no,
Any change in bowel habit?
no,
No diarrhea?
no,
Loose
doctor.
stool?
No,
No hard stool? No change in the stool color?
no,
Any problem in your water work?
no, doctor.
No pain during passing your water?
No, doctor.
Okay, Mr. Adam, do you have any? You said you have pain in your muscle. Do you have tiredness along with pain?
No tiredness.
Uh, the, do you feel that you look pale nowadays?
No,
Do you have any lump or bump in your body?
no,
Do you have any skin changes or skin rash?
no,
Uh, any uh, body temperature preference of weather?
no, doctor. But this time I need to seek warm weather because of my fever.
Mm. You notice any swelling in your neck?
No,
Any joint pain?
I have pain all over my body, so cannot specify.
Uh, in your joint, in your hand or your knee? Any
No,
problem?
no.
Okay, Mr. Adam. You mentioned it was mentioned in the letter that you go for travel 1 week ago to
Yes,
India.
I
Did you
came.
receive?
Doctor, I went actually 2 weeks back and came back 1 week ago.
Yes. Did you receive any vaccination before you go?
Yes, doctor.
What?
They gave me vaccine for hepatitis called for that is called some vaccine for hepatitis. I cannot exactly name that, and gave me some prophylaxis for malaria.
Do you remember the tablet you take?
I took all the medication as they said.
Yeah, and you receive it for how long?
I started 1 week before the travel and continued after about 5 days. Though they said to continue for 1 week after coming to back.
And you continue after you come back?
I continued for 5 days.
And they recommend you to continue 2 weeks after you come back, right?
1 week after.
1 week. Okay. During your travel, can you tell me where you stay?
Doctor, I went to actually that involved the visiting the city region and also visiting the village regions, and sometimes I also went to hiking on the forest also.
Have you experienced any insect bite?
Yes, doctor, frequent times.
Where?
That was also in the city wasn't so much clean. I got some bites were in the city also, and also some bites during the travel through the jungle, and that was not a specific, but didn't have any scar or any uh, rash after biting. But I can remember that I got a few bites.
Okay. Did you swim during your travel?
Yes,
Where, in the lake or in the
like
and what food you try there?
10 minutes past. Actually, truly speaking, doctor, I'm a food lover, so I tried all kinds of food, including all the street food and some regional local foods.
Okay. And did you what water kind of water? It is bottle
Yes,
or
all time
from
bottle
the.
water.
Okay. And I'm sorry to ask you, but did you experience any part-time relationship there?
No,
Okay. And I'm sorry to ask again, but do you use any drug through your channel,
no,
recreational drug?
no, doctor, no.
Okay. Okay. Mr. Adam, I missed to ask you, do you have any yellowish discoloration?
No,
No. Okay. Mr. Adam, can you tell me if you have any past medical history of not?
no, doctor. I was quite a good and fit person. I traveled a lot, and I didn't face any problem like this.
Mhm. And did you take any medication before?
Yes, all time I
What?
follow the travel guideline.
Mm-mm. And do you have any allergy to any medication?
No,
And have you ever admit to the hospital for any reason?
no,
Any operation?
no,
Any over-the-counter medication?
no,
Any family history of no?
no, doctor.
Can I ask you if anyone in your family or in your neighbor have like high body temperature?
No,
Anyone in your surrounding having diagnosed with tuberculosis?
no,
Okay, Mr. Adam, can I ask you if you ever smoke?
no, doctor.
And do you drink alcohol?
Very occasionally.
Okay, and do you know the social limit?
Yes, doctor. I usually don't take more than usual.
Okay. Can I ask you what do you do for living?
I work for a private company.
Okay. And you travel a lot.
Yes, doctor.
Okay. And can I ask you if you have any long-term relationship?
No,
Okay, Mr. Adam. Do you drive?
no.
Mr. Adam, can I examine you now?
Okay.
Okay, I will have a general look to Mr. Adam if there is any, what is the nutrition status, any
This is a
cachexia.
surrogate, not a real patient, but you can examine.
Okay, any cachexia,
No,
any pallor or jaundice,
no,
vital sign, what is the heart rate? Is he
134.
tachycardic? Hmm?
Pulse is
134.
134.
What is the blood pressure?
110/80.
100/80. Is he
110/80.
uh, any dehydration sign?
No,
Okay, I will check if any lymph node,
no,
if there is any lymph node. I will quick examine the lung if there is any crepitation,
no,
the abdomen if there is any organomegaly, any tenderness.
no,
I will check the spine if there is any tenderness,
no,
uh, any joint swelling, any.
no.
Okay. Take temperature.
130, 103.
Okay, Mr. Adam, can I know what is your concern?
Why I am having this, doctor? Is it something serious?
Mr. Adam, I appreciate your concern. I have uh, many differential in my mind. I need to admit you now and give you antibiotic and some tablet to reduce your temperature and to rehydrate you. And you need some investigation to rule out my differential. Most likely, you have a condition called inflammation, bug infection in your body. This due to the insect bite that you experience during your travel. We will do for you investigation to confirm the diagnosis, then we'll start you on treatment.
Okay, doctor.
At the same time, there is another some other differential. We should rule it out one by one. Is that okay?
Okay, doctor.
Any other concern for me, Mr. Adams?
Can I die from this, doctor?
Mr. Adam,
Solution before, doctor. So I'm really worried.
don't worry about that. You are in good hand. We'll give you the treatment. There is a very low probability. There is treatment available for your condition, and most patient response to treatment and improve.
Okay, doctor. Sounds good. Time up. So, did you reach any diagnosis?
For this scenario, there is many differential diagnoses. There is infectious reason like malaria, dengue fever, any infection in the urine or lung or GI, but there is no symptom supported this. And could be autoimmune disease like rheumatoid or SLE. Also, there is nothing in the history support this. Most likely, this patient suffering of infectious condition like malaria or dengue fever, and could be also brucellosis.
Okay, I cannot get to malaria and
Malaria, dengue fever, brucellosis, and I need to rule out the tuberculosis also.
okay. So how will you investigate him?
The patient need to do basic investigation, complete blood count, renal function test, liver function test, blood glucose, electrolyte, blood culture, urine culture, sputum culture, chest X-ray, urine analysis. He need a rapid test for malaria and serology for dengue fever and acid fast bacilli and serology for brucellosis.
Okay, that is fine. So I am coming.
Hmm.
Okay, I'm coming to the management. How will you manage him at this stage?
Management, as patient is tachycardic, he need admission for stabilization to give him antibiotic and IV fluid for rehydration. He need to be started on antibiotic after taking culture from the blood and urine and sputum and the stool. And we will do the investigation and treat accordingly.
Okay, that is fine. Your history taking was very fine. Just a few points on the history taking, that the patient in the travel history, that did he have experienced any similar symptoms or any abnormal symptoms during his stay? Okay.
I asked in the beginning if he has any previous episode of high body temperature.
Okay, especially during the travel, did he have experienced anything abnormal?
Hmm.
Okay.
Okay.
Otherwise, diagnosis here isn't clear. It comes with few differentials, and most likely with high body temperature, that is can be dengue fever, chikungunya fever, malaria, kala-azar, and other infectious condition. Okay.
Calazar should be hepatosplenomegaly, right?
Okay.
Uh,
Initial presentation can present with fever. For infectious and also for Indian region, there are some infection that is endemic to this area, like dengue fever, chikungunya fever, some viral encephalitis. That is also viral encephalitis is most likely to the Chinese region, Japanese region, and yellow fever that is specific to the South America. Okay, your approach was totally good. That is a very good thing. You didn't make up any sign, and you gave a differential, quite range of differential, and in this case, review his condition and review. You should review the current endemic status of the region, so that you can get an idea that what is happening in the region at now, in the Indian region, if there is any endemic outbreak, and also involving the infectious disease specialist, that will give you a better idea
yes.
if it is associated with any specific infection. Okay.
Yes. Always I should include multidisciplinary team in the management, right?
Yes.
Here I don't mention, so which is okay.
Okay. I think your performance was good. Okay, so